Hello and welcome to the program. I'm your host, Neil Howard. Thank you so much for joining us here on Health Professional Radio. Going to have a conversation with Dr. Charles Gerardo, and we're going to talk about snakebite prevention and treatment. Thanks so much for joining us, Doctor.
Thanks for having me.
Where do you practice snakebite prevention and treatment?
I practice in the Duke University Emergency Department.
Is snakebite prevention and treatment, is that something that is high on your priorities, or is it just one thing that you're familiar with and an expert in?
Well, as you can imagine, in emergency medicine, we see quite a number of diseases, but snakebite is a niche area for emergency medicine. So although it is not as common as, say, heart attacks or some other diseases, as you could imagine, we have to be prepared for anything. So these less common injuries or illnesses we need to be fully prepared for.
Now, summer is winding down. We're heading into fall. Does the change of the season diminish these snake bites in any way?
Yeah, absolutely. Snake bites are seasonal with the highest incidence in the summer, but we definitely see snake bites into fall. And particularly as the nights kind of cool down, but the days are still fairly warm, we'll get a lot of snake bites at dusk when people go out to take the trash out or get in their car and walk out on the concrete or the asphalt, and there may actually be a snake there warming themselves.
When I think of a snake bite, I automatically go to that poisonous variety. The majority of them, I think, aren't poisonous. Am I correct in that assumption?
Well, the majority of snakes in the U.S. are not venomous, and usually bite from those kinds of snakes is simple to care for. It's simple wound care, dealing with the puncture wounds and addressing tetanus and making sure they don't get infected and making sure the pain's adequately controlled. But the venomous snakes are a whole nother thing altogether.
So I guess a venomous bite would be classified as an emergency unless a non-venomous bite was so severe that it could be classified as such.
Yeah, all venomous snake bites where you have any symptoms are definitely emergencies.
Now, is the rattlesnake, that's the snake that most comes to mind when I'm thinking of a venomous bite. Are there different varieties of these snake bites?
Yes, rattlesnakes is a type of snake we call a pit viper. And in the U.S., there's more than just rattlesnakes when it comes to pit vipers. So we have rattlesnakes in a number of different species. We also have pygmy rattlesnakes. And then we have a group of snakes that are comprised of cottonmouths and copperheads. And where I practice, we see copperheads regularly. In fact, that's over 90% of our snake bites. Venomous snake bites, rather.
Is there something that we do when we come upon a snake that is more likely to get us bitten as opposed to someone who's more familiar with snake bite, or does it matter? No matter how knowledgeable you are about a snake, you're a candidate for a bite just by being in close proximity.
Well, I think anytime anyone, expert or not, comes upon a snake, that probably the best thing to do is to back away and get away and leave the animal alone. That's true for venomous or actually for non-venomous snakes. Snakes are pretty fragile and it's pretty easy to harm the animal. So although they're really interesting and people like to handle them and capture them, in general, that's not a great idea. And that's, of course, true for a venomous snake because that's going to increase the likelihood of you being bitten. And a lot of people that are bitten by snakes were messing with the snakes. That being said, there are definitely plenty of accidental envenomations, or we call them unprovoked envenomations, where someone was reaching into a wood pile or, something like that, reaching under, a debris pile and is bitten by a snake that's hiding in there.
Now, obviously, getting treatment as quickly as possible is key. What type of a time frame are we looking at? Say, as you said, you're reaching into that wood pile and you're at home and the hospital is 8 miles away, 10 miles away. Is it a good chance that you can get taken care of pretty readily, or are you in deep trouble the moment that you're bitten?
Well, the moment you're bitten, if you receive venom, and so it's a true envenomation and not a dry bite, the venom starts to do its thing, so to speak. but the presentations are really variable. So some patients immediately run into trouble, and other patients have even a delay before you can tell that they're going to have any symptoms from it. So there's a lot of variability, but we do know that early treatment leads to better outcomes. So from a patient standpoint, the way to look at it is as follows. If you're bitten, seek immediate medical care, and that way you can maximize the likelihood of having a good outcome.
You know, you mentioned that you see a lot of copperhead bites where you are, but that snake bites in general aren't way up on the list as far as people coming into the ER to seek treatment. When it comes to being well-versed in the treatment of snake bite, in your opinion, how versed are our ER staff in treating snake bites of these different varieties?
That's a great question. I think most providers and emergency departments are fully capable of handling the initial care. I think so. Our suggestion is you present to your local emergency department. Emergency physicians are trained in this, even if they don't see it frequently. Once you receive the initial care, kind of the initial resuscitation, so to speak, and receive ideally the initial medicine, the antivenom, if you have symptoms, then they can seek additional help from experts, either at the poison center or transfer the patient to a facility like ours that treats quite a number of these. Is
recovery a long process once the initial treatment has been administered?
It can be. It's of course quite variable. If you have a mild bite, you may be back to completely full function in a matter of weeks. But there are certainly people certainly have snake bites that they never fully recover. In particular, if they have a bite to the hand or the foot, they may never fully, that extremity may never be totally normal. Again, depending upon how much tissue loss there is and how severe it is. That being said, death is actually fairly rare in venomous snake bite. There's around 10,000 snake bites in the United States a year, when there's only 5 to 10 deaths. And that's primarily because we have good access and quick access to medical care and to the antivenom that's used to treat these. So I don't want patients or people to have to worry unnecessarily. If they seek care, they're usually going to have a good outcome. But the earlier, the better, to prevent any long-term disability the patient might have.
And wrapping up, Doctor, clear up maybe a misconception about antivenom. I've heard that in order to create an antivenom, it has to be from the exact variety of snake that you were bitten by. Is that true, or is that something that is just kind of a myth?
Well, there is some species specificity, but there's a lot of cross-reactivity. And by that, I mean it doesn't have to be the exact species that you were bitten by, but it has to be a similar class of snakes. So for the currently available antivenom in the United States, it's made from the venom of 4 different species, but it works for all North American pit vipers, which is the rattlesnakes, the cottonmouth, and the copperheads.
Well, we'd like to learn some more online about snake prevention and treatment. Where can we go online and get some more information?
I think if someone's bitten by a snake, or if they're interested in the treatment, there is an app available. It's called Snakebite 911, or you can go to the web and look up any of the FDA-approved antivenoms, and the currently available antivenom is Crofab is the trade name.
Well, I appreciate you coming in and speaking with us this morning.
Thanks so much for your time, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page when you visit us at hpr.fm.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.